Hi everybody, good afternoon, Dr. John Hayes, and welcome once again. I know it's been a while since we've been together in our video platforms, but as you can see we've done some rearranging here, plus some really phenomenal traveling. I hope you've seen some of the posts that we've done lifestyle related with regard to our recent travel to Italy and so on. Some really wonderful experiences. Today though, I want to talk about something that I've been reminded of in a very powerful way in the last couple of weeks with regard to pain and chronic pain and acute pain, and also the pain of peripheral neuropathy. And of course, this is something I've spent a very significant amount of my professional life doing, is trying to help patients like yourselves that do suffer from various forms of chronic pain and neuropathy. And a lot of you who are new here may not know that the work that we've done with regard to the applications of things like neurostimulation, nutrition, and laser therapy is going on 12 plus years now. So a very gratifying experience for me that not only has helped a lot of people, but also has led me to continue to expand my training and my education as well. But one of the things that I was reminded of so strongly after vacation was taking care of a couple of patients, two patients in particular, who were referred to me for a couple different conditions. One was a trauma, meaning a recent accident, but this lady also suffered from a very painful underlying disorder. And another peripheral neuropathy patient who has had peripheral neuropathy related to an underlying disease state, not diabetes, for many years. And in both of these cases, the thing that really struck me so hard, I don't know why I did, because this is something I do all the time, but both these patients had almost instantaneous relief with the use of the NDGen neurostimulation. Now, why is that? The reality is that pain, neuropathy, etc. is a complex physiologic phenomenon. And you've heard and watched some of the other videos that we've done on this over the years. You've seen some of the demonstrations that we've done. For those of you who are patients, you saw the recent demonstration that we did for patients inside reception room only on the use of the NDGen for joint pain, for example. But neurostimulation, when properly applied, is a phenomenally effective but underutilized tool for two reasons. Number one is it's not always made available to patients as the first option. That is, in fact, one of the things that we're changing, and that's why we make the NDGens. We have numerous NDGens for trial in our clinic so patients can use them and test and find out if they're really going to help give relief, give more comfort, and one of the most important things is to help patients with sleep. Well, the most amazing thing that I observed in both these patients, one in particular, is an amazing improvement in not only reduction of pain, tingling, numbness, but also in the ability to sleep better almost immediately. Okay? But the issue is, and I've talked about this many times before, and I'm sure I will again, all neurostimulation is not considered is not the same. It's not only not considered the same, but in actual fact, there are so many different forms of neurostimulation. For example, TENS, which is the common moniker or name for transcutaneous electric neurostimulation, is just like saying, well, you could use a car to treat your neuropathy, or you could use your TENS to treat neuropathy. Nothing could be further from the truth, because in order to have the dramatic results that we are seeing and have seen and talked about not only here but in our research on the reduction of pain and reduction of neuropathy symptoms, it is so critical to have the proper electric stimulation performed, and have it performed by trained personnel initially, so that you're doing it right, and then not only are you doing it right, but then you also will understand, is this something that could help you long term? This is also why we do a fair amount of telemedicine with patients, meaning that if you purchase an NDGen and you need help with it, our staff can help you. This is also why you become a member of Reception Room, which is the group that my team runs to help patients like yourself, like the patient we talked about last week, managing pain through the use of the NDGen, the wearable laser, and then the other things that we help patients with all the time, the diet, dietary changes, nutritional counseling, you name it. So in any event, I want to once again thank everybody for all your kind comments over the last couple weeks, and we'll get back and do as many videos with you as we can. But I did want to please implore you, if you haven't taken a look at the NDGen system, and you haven't taken a very, very hard look at what we actually do here, besides post some pretty cool things on social media, I recommend that you do. Okay, we're here to help you. Our offices are here to help you. I'm here to help you personally. My staff, God bless them all, works tirelessly day in and day out so you can have as much relief as you possibly can. All right, thanks so much for watching. Don't be afraid to click on the link below. Check out everything we have available for you, and please message us, send us an email, send us a text, whatever you'd like if you need your questions answered. Thanks so much. Have a great rest of your day, and we'll see you next time.